I want to eventually get into something like that, something along the lines of something like I've been wanting to build my practice more, so like with my wife coming on, hiring somebody, that kind of thing, and then kind of building out from there. But
what's going on, guys? Welcome back to another episode of my brand new YouTube series called Own Your Shit.
Yeah.
So we got featured professional physical therapist, Dr. Brian Wolfe, right?
Yeah.
With Wolfe Therapy?
Yeah, Wolfe Physical Therapy, yeah.
Wolfe Physical Therapy. So, Brian, tell us a little bit about why physical therapy as compared to maybe chiropractic care or massage therapy. What brought you into the realms of PT work?
Just like most physical therapists or probably even chiros and massage therapists, I hurt myself initially playing sports.
Okay.
Got into rehab, felt really great. I'll never forget the first time I picked up a baseball and threw it without pain. It was like, whoa, what is this, right? So I was sort of hooked after that. And I remember even thinking at the time, like, no way I'm going to do this. And I fell in love with it in college. From a PT standpoint, like, it just makes sense to me, working with the body. We do a lot of hands-on work, a lot of similar stuff to massage therapists and chiros do, with an exercise flair. So, everybody's different, so we kind of do a little bit of everything. It's a little bit of soft tissue work, a little bit of manipulation, fascial stretching, tons of exercise, that kind of stuff. So all different techniques. So it just depends on the person. But I love working with the active individual who's looking to get better, whether it's sports performance or they have injuries that are limiting their ability to do so.
Cool. So a couple things. How long have you been as Wolfe Physical Therapy?
About a year and a half. I started my practice last year in January. Yeah.
All right, so fresh off the ground running. Awesome.
Yeah.
Now you said you like working with athletes. Obviously, you being an athlete and breaking down yourself kind of led you into the realm, which tends to be, I've seen, especially with myself too. We've talked a little bit in the past. Being a professional wrestler and personally breaking down after 12 years of beating up my body has caused me to learn and understand more about how I need to take care of myself, and then the problems that just the general population seems to suffer from with lack of understanding. So we're here you primarily run your business out of CrossFit, right?
Yeah, CrossFit at Dynamic Athletics in Darien.
All right, so Fairfield County, Dynamic Athletics. How's that going for you in terms of you're getting more athletes from CrossFit coming to you to work with, or are you still bringing outside people in too?
Yeah, so it's a combination of both. So I definitely still work with a lot of athletes. Like I've worked with in the past, like high school, college, professional athletes as well. With my past work before I went off on my own and started my own business. And then I also myself do CrossFit regularly and a CrossFit athlete. It just worked beautifully between the two. PT kind of found me into CrossFit, and then I got hooked on CrossFit, and now the two have become an awesome synergy where if you're training this hard, you're gonna break down at times.
You're gonna break down.
And there's two pieces to that, right? So recovery is the key word. So if you're not recovering properly, whether it's, again, anything in my realm, whether it's nutrition, sleep, any of those things, if physical therapy is what you need to help recover, we're either gonna optimize your performance in sports or optimize your performance in CrossFit, or we're gonna allow you to rehab. So then you're gonna be able to rehab, move through the process where if you had an injury, now you can get back to CrossFit, you can get back to those sports. And then lastly is then we're gonna fix the problem and prevent the injury. So prevent the re-injury if something happens. So it's really a cool synergy with me and Dynamic and especially with CrossFit. So it works really well because I find that, especially with CrossFit, there's really motivated athletes in here that want to be really good at it, but also want to maintain their health and don't want to break down no matter what their age is. So really, I love to help those people. So that's awesome.
Awesome. So let me ask you a question for this. So you work as a physical therapist. I work as more of movement therapy in terms of, again, mobilizing and getting people to increase their flexibility and mobility. So we both are kind of along the lines of injury prevention and prehabilitation type of stuff. How difficult do you find trying to get the athlete mindset, or we'll use CrossFitter, the CrossFitter mindset of, this is what I love doing, I hate doing the preventive care, right? I hate doing the stretching. So how much of a barrier do you find for that when you're trying to get these athletes to understand that this is a necessity to keep doing what you want to do?
You know, I actually found, me personally, I found that the athletes or the CrossFit athletes that are super motivated are those people that like really have, I mean, I shouldn't say they don't have any barrier, because the biggest barrier I find is like the same stuff that I found going, right? Like time, can't have time to do this work, right? I come at 5 a.m. class, or come to 6 a.m. class, jump on the train, head to the city,
right?
You know, can't get that stuff done, right? So there I try and keep it simple, like trying like, all right, one or two exercises restoratively that you can do that can really help you on your own, right? Empower somebody. I also think that in terms of like the CrossFit athletes, it's just I break it down in like this 3 kind of simple steps. Like you have this pain, you have this problem, and you have this preventative process. So the pain is what people will a lot of times come to me. Well, I wouldn't even say that the pain is not necessarily what they're coming for, it's the loss of something, right? Like,
okay.
I have shoulder pain, so I can't do a bar muscle up, or I can't do a ring dip, or I can't climb the rope anymore, right? So that'll be the pain. So, or I have this back pain now, so I can't back squat. I'm hearing that constantly.
Yep.
Can't deadlift because of back pain or something like that. So, and these are really easy problems that can be fixed quickly. And that's what we talk about is, listen, here's your pain, here's your problem. We can get rid of your pain quickly, but we may not necessarily be able to fix your problem.
Okay, right.
So then we fix your problem via these exercises, and then guess what? Here's another series of things that you can prevent it. And so once you've gone through those steps, once people try and seek me out, it's kind of like, all right, it's come to a head, right? We need to get to a point here where we're preventing this thing from coming back. And usually we move in that step. I don't find, at least in CrossFit, I don't find as many barriers. I think also because I'm here all the time,
right?
Because I work out here all the time, people know me, so I'm constantly giving away things for free just because, you know, I know it's helpful to people, it's helpful to me. So people ask me, hey, what do I do for this? Hey, what do I do for that? And I said, I'm off the cuff, try this, off the cuff, try that. If it doesn't get better in 2-3 days, call me. You know, so it just depends on what people are looking for. For my like other athletes that aren't as motivated, I mean, those that's the tricky part, is how to motivate them. But
I will agree with that one. Yep.
Yeah, exactly.
Motivation seems to be an ever declining quality nowadays, which is it's kind of like common sense, right? Common sense isn't so common anymore.
Yeah.
Motivation seems to take the back seat for a lot of stuff.
Yeah.
So it's interesting that you said, and this is what I like, you know, for why I started this video series, is basically you're here all the time, you give away stuff, right? Yeah. You give away knowledge, you give away education, you're not in it for the money. We all want to make money, we all need to survive, but we, at least you and I, do what we do because we love helping people, because we see the benefit, we see the need and the necessity that's out there for people to just better understand their own bodies, how to take care of themselves, right? So that's awesome. That's kind of why I have this channel as well. So, you know, free content and the ability for people to see and listen to interviews from other health professionals in different spectrums that are out there in terms of thought process on health and wellness as a whole, not just the traditional stuff that you see. Awesome. So who, I guess, do you see yourself working with more in terms of male, female, age category? Is it more of like the 20, 30-year-olds that are maybe in CrossFit? But I know CrossFit has a wide spectrum of age range. But I guess male, female versus age, and then versus like the top 2 or 3 injuries that you see most of.
Cool, that's a great question. So, I mean, my ideal client, I treat anybody and everybody, whether it's the male or female CrossFitter, whether it's like the young 20-year-old, the young, 30, 40, 50, weekend warrior. I'll tell you, my personal favorite group to work with are the male and female 40s to like 60s, who are like the group that I commonly have heard other people say, I can't do that anymore. Okay. And to me, like, my biggest thing of what I love in physical therapy and what I can do is empower people. So it's like, hey, you can do this. You just have to do this to help something, right? Or I used to be good at it, but those days are over for me. Like that client. So sometimes that client's younger, sometimes that client's the 20, 30. And I love working with my high school athletes. I love working with college athletes. Like they're awesome too. But then the mindset is optimizing performance, looking for them. But the weekend warrior that's coming in here at 5 a.m. or 6 a.m. That's like, you know, hurt their hamstring, hurt their shoulder, hurt this. Maybe this just isn't for me anymore. I'm like, no. Like that's like CrossFit is for anybody. I mean, we're even talking. I'd love to. We're talking about trying to figure out a way to do a Legends program for 65 plus. Right?
Okay.
So to get some like older folks in here too, and like, listen, you can move. Longevity is everything. Like, we want to move beautifully throughout our entire life, whether you're 9 years old, whether you're 99 years old. So to me, like that, I find that mid 40s, like 40 to 50, is like a really key age that seems to be where people start to say, you know what, maybe I can give up X, Y, and Z now because I have this pain, I have this problem. Though that's my favorite person to treat, because then I can reverse that I feel is like that's the people I can make the biggest impact on. But again, I work with any athlete that wants to work with me. But that's my favorite one personally.
And that's a lot of mindset.
Totally.
That's at the. So you're trying to get to that mindset shift before they shift into, well, it's just old age,
That's right.
or the doctor just said I can't do this anymore, I have to give it up. And like you said, we want to be able to move fluidly for our entire lives. Movement shouldn't stop, right? Movement only stops when you're dead. Then you're stiff and rigid.
Right. Yeah.
Life should be fluid and flow. So awesome. So 40s to 60s average, male, female, either or. And then injuries. What are some of the top 3 or 2 injuries that you're always seeing?
I mean, the top 3 off the bat, no brainer, are back, neck, shoulder. I mean, so that's everybody. I mean, 80,
CrossFitters.
80. I mean, you're doing a lot of spinal loading. You're doing a lot of different work. There's a lot of compensatory movements, and if you don't have full mobility, full range of motion of all your joints, you're gonna feel it in your back. You're gonna feel it in your neck. You're gonna feel your shoulders. And these are simple things that can be fixed really quickly,
and on your own, right?
Yeah,
Things that you can do on your own, guys. So that's
my goal of any of it is almost a bad business model. It's like almost to put myself out of business. My goal is fix the problem, show you how to prevent it, call me if you need me, and that's it. And the reality is like that. I try and do that quickly, effectively. You know, and you said like we're all trying to make money, of course, because we need to do that to feed our families. But and I got 2 small kids I got to send to college, so I keep looking at that. But at the same time,
I got no kids. Guys. No kids yet.
but at the same time, just teaching people how to better themselves is my favorite way to do the marketing, because I've written different ebooks on my website. For neck pain, back pain, shoulder pain. I definitely have some knee pain as well, but the top 3. But when you're doing stuff like a back squat, when you're doing stuff like deadlifting, or when you're doing stuff like even like an overhead squat, or snatch, or any type of the snatch balances or cleans, you're doing a ton of loading to your spine, and that's just with a barbell, right? Then you take in any box jumps, any kettlebell swings. Any more of those things, it's repetitive loading on your spine.
Yep.
And if you're doing this stuff incorrectly, or you don't have the right mobility to do that stuff, it's just a matter of time. It's not going to be something that Father Time is undefeated. You know what I mean? So it'll get us all with that at some point. And then shoulders. I mean, the biggest thing with the shoulders is, again, I think linking the spine mobility. If you don't have the spine mobility to get and lock out overhead, eventually someone will say, oh, I have this, or I have that, or I'll have something with a rope climb or a pole, or with a pull-up. So it just depends on. But those are definitely the top 3 things.
Well, and so I'm gonna assume that you're gonna be in the same mindset. But with what I do, I have people that will come to me, or I will watch other trainers working with their clientele who don't have that full range of motion. And it's not because of a restriction. It's not because of, they've had maybe a shoulder replacement and they just are limited to that range of motion, but it's something that their body needs to be opened up to, and they don't have that range of motion, and yet they're doing techniques that they shouldn't be doing without that range of motion, so that there's already compensation going on, and there's things that are occurring that will eventually lead to breakdown.
Yeah, I mean, I think it definitely depends. Everybody's different. I would definitely say that there's 2 different. The old adage I always use is I go, there's either a stability problem or a mobility problem, right? So I say the old adage is we either need to duct tape it or we need to WD-40 it, right? Like it needs to move a little bit better, or it needs to be stabilized a little better. So I think I see like the runs the gamut, and I think initially my mindset when I first started really treating a ton of CrossFit athletes was, everything's mobility related, because because these guys are working really hard and you're doing things. But totally on the flip side too, when we start ramping up and increasing weights, you see it runs both the gambit as well. So totally, I mean, mobility is a huge piece. People will lose mobility in here, and then that leads to some different problems. But these compensations can also lead to stability defects because you're not getting the same type of, so you're not engaging your lats with the pull-ups, so then you're pulling from your biceps, or you know, and then you're getting that shoulder pain and that pain in front, or you know, you're doing something with a deadlift where you're not pulling your posterior chain, so your glutes and hamstrings aren't firing, so bam, here comes the back pain, right? So same thing with the squats. If the core is overactivating, so there's a biggie that I've been doing lately is I'm all about core activation for prevention of back pain, but I've been having lately some really strong, like the rectus abdominis where it's super tight, and the hamstrings aren't pulling their weight, so all of a sudden with back squats someone's getting pain. So things like that are interesting when I'll see that, so, you know, lately what has been happening. So which is a reverse thinking, I think, sometimes of what
everybody thinks that, you know, you need to strengthen your core, but you're saying that you see over-strengthened core and underactive other areas.
Almost like it takes over. Like, you know, sometimes it'll, because that'll inhibit, you know, if we're thinking about the rotation of the hips, it'll bring this rotation of the hips, and the hamstring's supposed to help it do that primarily, and the core's supposed to stabilize. Well, if it's doing all the movement and pulling, then all of a sudden we'll see this issue in the hamstrings will actually will sometimes either lengthen or underactivate and cause that pain with the squat. So then all of a sudden you're getting that axial load into the spine. So kind of a neat, that's more of a recent finding that I've seen with some people, but definitely, you know, obviously, you know, core strength is huge too, so it runs the game. But I definitely see those things all over the place.
And guys, so that's the important issue of, you know, you don't have physical therapists or trainers that are educated in certain techniques and better movements, or, you know, somebody like me that's kind of in between PT and training and does a little bit more corrective functional exercising and movement therapy. But if you've got something going on, it doesn't always mean that it's what you think is going on. Like, you know, you might have a really strong core and maybe your quads or your hamstrings are really tight, but that's not really what the issue is. It's from somewhere else. So having somebody that has the knowledge and the ability to understand that and see kind of your body as how it's functioning and what you can do to alleviate it, because I've seen people that stretch their hamstrings all the time, and guess what? It's a calf and an ankle mobility problem. And once you release that, then the hamstrings tag along right with it. So don't just steer clear of PTs because you think that's what you need after surgery or after some type of injury. If you've got something that's starting to accumulate, check it out, get it looked at quicker and prevent further breakdown.
And even to piggyback on that, because I think that's such a great thing. Like, I think a lot of people sometimes don't know exactly what we do. You know, one of the perceptions of PT is, oh, that's after I have surgery, right? Or after I have that, I go for my rehab. Well, also, I mean, mainly the one thing and niche I've worked into is more preventative medicine. You know, so that you're avoiding surgery, you're avoiding these injections, you're avoiding using medication for the rest of your life for pain. It's like, hey, how about instead we teach you how to do this stuff properly? And we made you do some manual work, made you do some stuff to stretch, or we made you do some soft tissue work, and then give you the stuff to do on your own so that you can prevent this from coming. So you don't have to worry about the surgeon. And I tell people come to me directly. You don't even need to worry about, in Connecticut, you don't have to worry about going to a doctor first.
Right.
You come to me and just ask me questions and we can set something up.
You're almost better, guys, and we're going to wrap this up quick, but you're almost better going to an independent PT, right? So if you go to one of these larger physical therapy companies or, you know, businesses, it's just more, unfortunately, this turnover type of system where the independent physical therapist, the independent trainer get the concept of, I want to help you on the full spectrum, not protocol, not I'm stuck to what the doctor's script says. It's basically, hey, we can look at you as a whole and figure out what's going on so that we don't need 25 sessions. Maybe we can get you out in 5 sessions and teach you what you could do yourself. So if you're using a chiropractor, which these guys are notorious for, especially the old thought process, where they need to see you 3 days a week for the rest of your life, there's something wrong. They need to teach you how you can prevent your own stuff and then see you once in a while, just like, you know, Dr. Wolfe or myself would want. I don't want to see you for the same issue over and over and over again.
Totally.
So Brian, you mentioned your website. Where can we find you for your website?
So WolfePhysicalTherapy.com is my website, Wolfe with an E.
Wolfe with an E, we'll put that up there.
WolfePhysicalTherapy.com, and then my Facebook is at Wolfe Physical Therapy. You should find it there. And then Twitter, it's bwolf2. bwolf2, and then Instagram it's btwolf02. So those are the.
Okay, so Twitter bwolf2.
Yeah.
We'll throw that up on the screen, and Instagram is
btwolf02.
Okay.
Yeah. So
because they were obviously his name was taken on other sites.
Exactly.
So awesome. We're gonna throw all of this up there for him, so you can follow his links, add him on IG, follow him on Facebook. That's a Facebook page or your personal account?
That's a Facebook page.
Okay, Facebook page. So follow him on there. If you want, I'll throw his. Well, you have your email on your website, right?
Yeah.
Right.
It's B using my name, Brian Wolfe, WOLFE, WolfePhysicalTherapy.com. So that's my email too. So
okay, so we'll throw that in the section below this video. But if you guys are interested in subscribing to his newsletter
and YouTube channel too, so I have a YouTube channel also.
And he's got YouTube. All right, good. Because most people don't have.
Yeah. YouTube. And I think it's also my personal one, Brian Wolfe. So if you check out Brian Wolfe Physical Therapy, you'll find the YouTube channel too.
Okay, good. So he's good. He's represented on all social platforms. He's the only one so far.
Not as well as I should be. I'm trying to get more on there.
All right, so awesome. Brian, thank you very much for interviewing. Last thing I would say, I always try to end it with, if you had one thing to recommend to, I guess, the general populace that are suffering from pain, maybe, what would you recommend maybe as a starting thing to start doing for themselves?
The number one thing I would say is use ice if it hurts, right? If something like that hurts, you want to be, and that's an easy, safe thing. Ice is easy as an anti-inflammatory process, and move. You know, one of the big things I hear all the time that drives me nuts is I went to so-and-so and they told me to rest it.
Yeah.
Oh man, I mean, now, again, we talk about the pain problem prevention. It's, you need to move, or you need to find somebody that wants you to move, because movement is going to be what ultimately fixes the problem.
Right.
You know, rest doesn't address the problem. It may address the pain, but it won't fix the problem.
Sure. So movement is medicine. You've heard it before. All right, Brian, thank you once again.
Absolutely.
Stay tuned for another episode of Own Your Shit. I don't know who it's going to be, but it's going to be somebody good.